Good evening. My name is Kellene and I'm so excited to share with you my evidence-based practice PICO project for this course. Does your organization struggle with nursing turnover? Is it difficult to recruit and keep qualified new graduate nurses? Are the costs of nursing turnover skyrocketing for your organization? Is your patient care suffering? Adverse patient events increasing? There is evidence-based practice for that. The average cost of turnover for one nurse is between $37,000 and $58,000. When you consider that nursing turnover costs hospitals nearly $8 million annually, that is a staggering number and something that management and leaders need to be aware of. The rationale and significance of this problem is that as leaders and nurses, we have to be finding solutions to a problem that is rampant over the entire United States. Nearly 18% of new graduate nurses will leave their first nursing job in the first year of employment. We have to be able to attract and retain qualified new graduate nurses to fill our positions and to reduce the nursing shortage. This requires training and orientation. So my PICO question for this project is, in healthcare organizations, does adopting a structured 6-month orientation curriculum with preceptorship compared to a fragmented orientation without preceptorship significantly improve nursing retention for newly licensed registered nurses in the first year of employment with a healthcare organization? As I break down the PICO pieces of the PICO question, the population of interest is newly graduated registered nurses. The intervention to be applied is structured 6-month orientation curriculum with preceptorship. The comparative intervention is fragmented, unstructured orientation curriculum without preceptorship. The O is the outcome to be measured, improved nursing retention, and the time frame is in the first year of employment. So as I went to research and review articles and research and literature regarding this topic, the searches included EBSCOhost, Medline, ProQuest Nursing and Allied Health Source, Science Direct, and Genol. There were 8 articles included for review in this project, and I started to review 14 very in depth, and then I ended up reviewing like 22 of them. 4 of these that I chose were systematic reviews, which are the highest level of evidence. 1 was a literature review, which is a bit lower of level of evidence than a systematic review because of the amount of rigor and quality. 1 was a randomized control trial, which is the second highest level of evidence. And 1 was a quality improvement project and an EBP project, which are at the lower levels of evidence. They're the second to the lowest level of evidence. However, I found that the quality improvement project and the EBP project showed the most promise for this project. So as I went to synthesize the evidence, I found a couple of interesting things. So validity, for the most part, was shown in most of these research articles because they provided some type of orientation program that proved to positively impact nursing retention. But in some of the studies, it was unclear that a specific type of structured orientation program with preceptorship improves retention. So I think it was the difference of a structured orientation program with preceptorship. Some of the articles also described different interventions not related to training or orientation at improving nursing retention for new graduate nurses, and so they did not really apply to this project, although they did show that training, they did end up showing evidence that training was useful at improving retention. A few of the articles did not prove reliability because as improvement rates of the new graduate nurses was not sustained over time. So they started out and they were retained, but then over time they did not retain those nurses. The EBP project and the QI study that I reviewed showed the most promising evidence, and they really aligned well with the population of interest for my project. which is the intervention, the comparative intervention, and the outcome measures for my PICO project. But what I found interesting was the duration of the orientation programs for all 8 studies was not 6 months. So it ranged between 27 weeks, 52 weeks, 3 months, 18 months. So I really found it difficult to find evidence that proved that a 6-month duration was applicable and useful. All studies did prove some kind of applicability, though, because they used training curriculums and they did produce positive effects for nursing retention. So as I mentioned before, residency program, the evidence showed that residency programs, transition to practice programs, structured orientation, preceptorship, and a clinical ladder for about 3 to 18 months improves retention rates of new graduate nurses, job satisfaction, competence, and organizational costs. And the population for all of this was new graduate nurses. So I had to look at the feasibility and integrating this EBP project. First of all, you have to take a look at the stakeholders, which are the board of directors and the senior leaders, unit staff, unit directors, and also the medical staff, because this PICO project may, because it's a 6-month duration, may keep new graduate nurses from being on the floor working sooner, as soon as necessary, and that might cause some difficulties with workflow. There has to be a work plan created delineating responsibilities and timeframes for staff to get completed. There has to be an adoption of a curriculum, which can be either a purchased, they're very inexpensive, purchased curriculum through like NCSBN, or there are other programs that are out there for the curriculum for new nurse graduate, like a transition to practice program or a residency program. There also has to be a preceptor recruitment. You can also use an internal curriculum, which is written by someone in the organization. However, that does not necessarily produce evidence-based practice results. So that is not, some of the articles I reviewed showed that internal curriculums were useful, but it would just have to be evidence-based curriculum. And then obviously there has to be a recruitment of new nurses for the program. Feasibility is definitely noticed because the cost of a curriculum compared to the cost of turnover for nursing staff is there's no comparison. What I found was that curriculums range from $60 to $150, I think it was, and the when you consider that against the cost of turnover of one nurse, it's really difficult to make that argument. So the theorist that I chose to use for this, and the theory that I chose to use for this EBP project was that of Dr. Patricia Benner, her From Novice to Expert Theory in 1982. Dr. Benner used the premise that there are 5 stages of learning: the novice, advanced beginner, competent, proficient, and expert. And new graduate nurses come to an organization as a novice, possibly as an advanced beginner, but they really lack the skills necessary. They have the enthusiasm, but they lack the skills. And it's the job of the expert nurses and the proficient nurses and even the competent nurses in those stages to really model skills and behaviors and policies and all of that. And what Dr. Benner found was that a structured curriculum with preceptorship is actually beneficial for those new novice nurses or advanced beginner nurses. So obviously there's always some challenges and barriers and limitations when you're looking into an EBP project. And some of the limitations and barriers for this project could be lack of available resources such as finances to begin the structured orientation curriculum. There's going to be some personnel costs to get it going, and then also you may have to compensate the preceptors a little bit more if they choose to do that. And then there also needs to be adequate numbers of personnel to complete this kind of an EBP project. Additional barriers may include the lack of the buy-in from leaders and other staff or members, as having a longer training period for new nurses may prohibit them from covering shifts sooner. So this could be a barrier to buy-in and support. I could not find any ethical considerations that must be addressed with this project, so that was one good thing. Considerations of sociocultural aspects of EBP change include the current pay-for-performance model, which may positively be impacted by this project. So a lot of the payer sources are looking for that pay for performance, the quality, and making sure everything is great with your organization. And so decreasing nurse turnover and improving nurse retention for new graduate nurses could certainly, and also providing some competency skills could certainly improve that. There would also be a decrease in errors. Costs would decrease for the organization. You might put that pleasure back in the job for some of those new graduate nurses who are scared and have some anxiety over starting a new position. So those are all sociocultural factors for consideration. So the outcomes that are to be measured with this are improved nursing rates for new graduate RNs, job satisfaction and competence in the first year of employment, and additional potential benefits of this EBP change could be reduced overall organizational turnover and recruitment costs for qualified registered nurses, and improved quality as reflected in patient satisfaction surveys, and a decrease in adverse patient events and errors of new graduates. So those are all things that could happen with this new EBP project plan. Some of the other things that we talked about, so the assessment and evaluation parameters, definitely a decrease in cost. I mentioned the competence and having a happy work staff. So the assessment and evaluation parameters include 20% improvement in new graduate nurse perceptions of job satisfaction and competence, 15% improvement in new graduate nurse retention rates, 20% reduced costs for recruitment and turnover for the organization, which I think are significant. Some of the ways that we will evaluate the outcomes of this project are to take a baseline retention rate. We'll gather some data on retention rates currently with the current model of orientation. And after the first class has gone through and in that first year, we will gather data on retention rates through a tool used in our human resource in our organization. We'll use that tool to gauge the retention rates of those new graduate nurses. We'll also send out baseline surveys and self-assessment questionnaires. The baseline surveys and the self-assessment questionnaires will just be to gauge the new nurses' interest, how their perceptions and feelings about their competence and their skill level. And we'll also send out an evaluation to see how they liked the course and gauge, objectively see how they viewed the course content and the preceptors. I just had to share this. So the evidence is in the books that a curriculum-based program does work, and you can see here the little cartoon that the preceptor is welcoming the new student, and I thought that was pretty nice. Future research would mean needs to be completed on how much time is enough time for training. You know, some of the studies that I found, they all varied in the different time frames. So I want to make sure, and then also which curriculum is best. There were transition to practice programs, there were residency programs, there were self-written curriculums. Which one of these curriculums is best to prove validity, reliability, and applicability for organizations? In conclusion, I want to talk about the implications and the implementation of a structured 6-month orientation program. It is such a valuable first step in improving nursing retention rates. It has been so exciting and rewarding to truly synthesize the current research and find the best evidence for this project. It all starts with asking that burning clinical question and using EBP to guide clinical decisions. And support the decisions that we make. And I have found that to be tremendously rewarding. I also had to share this from Benjamin Franklin. It says, "Tell me and I forget, teach me and I may remember, involve me and I learn." So I think that the structured 6-month orientation program for new nurses with a preceptor and a mentor to really guide and bring them along is that involvement part. And I really feel like that is what is necessary to get our new nursing graduates to feel levels of job satisfaction, competence, and feelings of certainty about their positions and role responsibilities, and help them want to stay with an organization. They'll feel that connectedness and that commitment to the organization. References are listed below, and I thank you so very much.